Hello, my name is Monique Rennie, and I am the Director of Scientific Affairs for MolecuLight. Today, I'm discussing data entitled Quantitative versus Semi-Quantitative Measurements of Bacterial Load in Wounds, which is an assessment from over 1,000 data points as part of a 350-patient trial. Quantitative tissue microbiology of biopsies, which provides colony per gram information, colony forming units per gram information, is the gold standard to accurately measure and to monitor wound bacterial load. And guidelines recommend that wounds be treated based on these quantitative culture values. However, availability and cost of quantitative methods greatly limit their use, and therefore semi-quantitative cultures are the most commonly used worldwide to guide wound treatment decisions, as well as standard of care assessment with clinical signs and symptoms at the bedside. A large, robust comparison between these two methods, quantitative and semi-quantitative, is lacking in the literature. So when clinicians receive a semi-quantitative lab report, which reports light growth or moderate growth of a bacteria, there's a lack of knowledge of what that truly means in colony forming units per gram, which limits the ability to prescribe treatments based on guidelines. So here we compare microbiological findings of quantitative and semi-quantitative culture in 1,053 bacterial isolates from 350 chronic wounds spanning all wound types: diabetic foot, venous leg, pressure ulcer, surgical site, and other types. 428 biopsies were gathered from these wounds from 14 clinical sites, 20 clinicians, as part of a multi-site clinical trial. Now, the trial was designed to look at fluorescence signals from wound bacteria using the MolecuLight point-of-care fluorescence imaging device, but the data that I'll show today is just the microbiological analysis of those trial results. All the biopsies were assessed both with semi-quantitative and quantitative cultures. Semi-quantitative used the 4-quadrant method and for total bacterial load in occasional, light, moderate, or heavy. And then for quantitative cultures, homogenate was used to make serial dilutions prior to inoculation, and that's reported as colony forming units per gram. So let's look at what the data showed. These are box and whisker plots, so I'll just tell you a bit about how to read these plots. The box itself, the lines of the box represent the 25th, the 50th, or the median, and then the 75th percentile. And then the whiskers, which are the error bars on either side of the plots, show the minimum and maximum values. And then the red dotted line shows the mean value. So for example, if you look up at heavy growth at the top of the curve, you can see that those values spanned everywhere from 10 to the 5 all the way up to 10 to the 9, which is 4 logs of bacterial growth. And the individual data points are plotted on the graphs as well as the gray circles. So for both heavy and moderate growth, the data spanned 4 logs. Moderate growth ranged from 10 to the 4 up to 10 to the 8. And then for light and occasional growth, the data spanned 3 logs. And these were particularly interesting because you see that light growth spans all the way up to 10 to the 5 CFU per gram. And typically when a clinician gets a report back of light growth, you wouldn't assume that there's a bacterial load that's this high, which is known to delay healing, and in some cases may be infection. And then occasional growth also spanned 3 logs, anywhere from 10 to the 2 up to 10 to the 4. There's many implications of these findings. Clinicians do make their treatment decisions based on semi-quantitative culture, assuming that light and occasional growth are not of great concern. But these results, from, to our knowledge, the largest comparative study of these methods to date, report that the majority of light growth wound microbiology corresponds to loads that impair healing, and those are loads of 10 to the 4 and 10 to the 5 CFU per gram. And guidelines state that these loads are to be identified and removed through methods such as cleaning and debridement. We propose that use of a point-of-care diagnostic that can identify bacterial loads higher than 10 to the 4 colony-forming units per gram, a load that does impair healing, can reduce reliance on semi-quantitative culture analysis. And this can be done with the MolecuLight iX point-of-care imaging device by providing immediate information on location and extent of bacterial wounds and immediate information on treatment efficacy at the bedside without the delays associated with waiting for culture reports. Thank you very much.